Welcome to JAT Chat, presented by the Journal of Athletic Training, the official journal of the National Athletic Trainers Association. I'm Dr. Shelby Baez, an assistant professor in the Department of Exercise and Sports Science at UNC Chapel Hill, and the co-host of JAT Chat. Today, I have the pleasure of being joined by Dr. Rachel Gohagan, who is an assistant professor of athletic training at A.T. Still University. She's an author of Advancing Care for Pregnant and Postpartum Athletes, a Call to Action for Athletic Trainers, published in the Journal of Athletic Training. Rachel, thank you so much for joining me today.
Thank you for having me, Shelby. I appreciate the opportunity to highlight this article that we wrote.
Yeah, not a problem. So starting with a very broad question for our listeners, what is the landscape of evidence regarding perinatal athletes in science, exercise, and sports medicine?
So the answer to this question was really the driver behind this article initially, because sadly the evidence base for perinatal athletes is strikingly thin. Most of what we know about exercise during pregnancy comes from small scale or recreational populations that aren't competitive or they're not elite athletes. They don't do exercise for a living like our tactical athletes. And so studies often exclude pregnant participants entirely. We know it's hard to get IRBs to approve research on pregnant patients. They're a protected population. And so this leads to low quality evidence, small samples, and an over-reliance on expert opinion rather than strong data. So it really creates real clinical gaps when we're working with patients who are pregnant and want to continue exercising. And so especially around injury mechanisms, return to sport protocols, and the intersection of pregnancy with musculoskeletal, psychological, and performance outcomes. The good news and the really exciting news is that researchers are now beginning to examine these questions more systematically. I have a lot of colleagues in physical therapy who are looking at these research gaps and trying to close them. And it presents a real opportunity for athletic trainers to help shape the evidence base moving forward. So this is our opportunity to jump in and join those researchers who are already doing this exciting work.
So I hear that we have a long way to go, but we're on the starting path to develop some more evidence in this space for our pregnant and postpartum athletes.
We are absolutely. Yeah, we're slowly moving from expert opinion because there are already clinicians working with these populations to gathering real data.
Now, this article was written as a specific call to action for athletic trainers. And what is the role of athletic trainers in the care of pregnant and postpartum patients?
Oh, we fill a critical gap. We have a crucial role to fill. We already manage musculoskeletal and physiological adaptations to stress. We already learned that in school where we're critically positioned to establish those adaptations. And we offer exactly the kind of expertise needed during and after pregnancy. So athletic trainers we can monitor maternal and fetal health during training. We can create that safe space for pregnant athletes to be able to continue exercising. We can monitor those vitals and those baseline vitals. We can modify programs safely as during pregnancy, the body adapts and it changes. And so we can monitor those adaptations and modify programs accordingly. We can recognize complications early. We already received that education. We already have that training. So no extra training needed. And then we can support mental and emotional well-being both during pregnancy and in the postpartum phase. Because athletic trainers often have the closest daily contact with our patients, we have that personal relationship already with them. We're in the perfect position to facilitate communication across the care team. And so it's really important to build that care team around the patient so we can communicate from obstetricians to pelvic floor therapists to dietitians. We can build that care team. We can educate the athlete. We can translate kind of that information that they're receiving. And then we can ensure care remains collaborative and patient-centered.
So we have lots of opportunities as athletic trainers to make sure that we can contribute to the care of these athletes.
Oh, absolutely. Definitely. And don't be afraid. It's the first time I had a patient report that she had a baby just a year before and was wanted to get back to collegiate basketball. I was scared. And so I encourage athletic trainers, don't be scared. And I have a great poker face because I'm an experienced clinician, but this is an opportunity. It's not scary. It's an opportunity to provide patient-centered collaborative care.
Now, as athletic trainers, what are some considerations and potential challenges of providing care to pregnant and postpartum patients?
So, the biggest challenge is the variability of pregnancy itself. No two pregnancies are alike. Physiological changes touch every organ system, so cardiovascular load increases, ligamentous laxity affects joint stability, and posture shifts alter biomechanics. So, common conditions like diastasis recti, incontinence, or preeclampsia require vigilance and sometimes referral, often referral in those cases. So it's about developing that individual care for the individual in front of us. But it's not unlike any other health condition that we care for, that we help guide our patients through. We provide that individual patient-centered care. From a postpartum perspective, the challenges evolve. Tissue healing, we have to be concerned about healing following the birth, hormonal recovery, breastfeeding related fatigue. So breastfeeding presents its own challenge, and nutritional demands all influence return to play. So athletic trainers, we have to tailor plans based on the type of birth, cesarean versus vaginal birth, recovery timeline, and the functional readiness rather than arbitrary weeks on a calendar. So we can't just mark our calendar and say our patient should be here at this date. It really is, it's fluid, it's dynamic, and it depends on the patient's progress.
So, whole person, individualized approach to healthcare and management.
Absolutely. That whole person healthcare, absolutely.
Now, are there any specific trimester considerations or return to sport considerations with this population?
Yes. So each trimester brings distinct physiological shifts. So again, we can't look at a calendar and say and put everybody into boxes, every patient into a neat little box. But there are distinct physiological shifts across the trimester. So in the first trimester, we see increased cardiac output. Ligament laxity means athletic trainers should monitor exertion, the patient's exertion, as well as temperature regulation because of that increased cardiac output. So, maybe I live in Phoenix, so maybe exercising outdoors in the first trimester in the summertime is not the best place for that patient. In the second trimester, we look at balancing changes or balance changes and swelling begin to affect proprioception and coordination. And so the fetus is growing, so their balance is shifting. So we have to be aware of falls and proprioception. In the third trimester, we see significant postural adaptations and edema that heighten the risk of injury. So, this is where we actually see the most hospitalizations and the most musculoskeletal injuries in that third trimester. So, training in the third trimester must emphasize safety and support as those postural adaptations occur. And so, from a postpartum perspective, so not just during pregnancy, return to sport should follow a phased progression. Again, it's individualized phase progression, typically light aerobic activity after about 6 to 8 weeks, and then advance only when wound healing, pelvic floor function, and mental readiness are confirmed. And collaboration across the interprofessional team is key, and that's equal collaboration across the team, not a hierarchical collaboration, and that ensures safety and confidence in the process.
Well, thank you for sharing those considerations. I think that's super helpful for a lot of athletic trainers listening to this podcast right now. As there's a lack of evidence in this space, as you've already alluded to previously, where do we go from here as athletic training educators, researchers, and clinicians?
Well, Shelby, this is our moment to advance the profession in through three fronts. So, beginning with education, we look to integrate female-specific and perinatal health into athletic training curricula and continuing education. I remember my first encounter with a postpartum athlete, I remember distinctly thinking I didn't learn about this in AT school, and I felt ill prepared. And so it was incumbent upon me to really dive into the existing literature at the time, which that's our role as clinicians, but we should be exposing our students early on, because pregnancy has the potential to affect 50% of our patient population. And that's huge. So preparing our students early to be aware of this health condition, as we do a myriad of other health conditions. From a research perspective, we should look to increase sex equitable representation in sports medicine studies and develop consensus guidelines for training and rehabilitation during and after pregnancy. So researchers, really, this is an opportunity to dive into establishing, collecting those data and establishing those guidelines for elite athletes, for competitive athletes, tactical athletes. We have decent research from a recreational athlete perspective, but we have athletes who are doing this for a living. And they can't put their family life on hold while they're earning an income. And then from a clinical practice perspective, we need to empower athletic trainers to screen, document, and refer confidently while engaging in that shared decision making with patients and other providers. And so we work well on interprofessional teams. Again, it's not scary. It's an opportunity for athletic trainers to work with that team and refer confidently, know your providers in advance. So that way, when you have that patient walk through the door, you're ready for those referrals and to build that team around them.
So, speaking of opportunities, how can the National Athletic Trainers Association and other professional organizations support these efforts?
Yeah, they can support and elevate this conversation by publishing position statements and clinical guidelines on perinatal care. The NCAA has some statements in support of pregnancy in student athletes, but the NATA really should push a position statement, publish a position statement and clinical guidelines in this area. Supporting continuing education opportunities for athletic trainers. I've seen several conference presentations on this topic, providing guidance in the postpartum aspect as well as pregnancy aspect, and then advocating for inclusion of perinatal content in KD standards and BOC competencies. So right now, it's implied in the KD standards, but it should be more explicit. The KD standards list a lot of conditions explicitly. This should be one of those that's listed explicitly. Such actions signal to clinicians and patients that and to the public that pregnancy and postpartum care are part of comprehensive ethical athletic health care.
Well, I appreciate those recommendations. Would you mind providing our listeners with a take-home point about your paper? What's the most important thing that you want our listeners to get when they read your paper?
Sure. There is so much. This is a topic I'm so passionate about. But the bottom line, pregnancy and postpartum aren't detours from athletic identity. They're part of the athlete's continuum of care. Athletic trainers have the tools, we have the compassion, and we have the interprofessional mindset to ensure that these patients receive evidence-informed, individualized, and dignified care. Our call to action, it's simple. Bring female-specific health to the forefront of athletic training, education, research, and practice so that no athlete's pregnancy journey happens in the margins.
Well, Rachel, thank you so much for joining us today and for having this important conversation with me. This article is available free of charge by the Journal of Athletic Training. I highly recommend everyone go and download this manuscript in the journal. Again, thank you so much, and we will see you next time.
Thank you, Shelby.